Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of the Checkup. Puerto Rico is still rebuilding from the devastation that Hurricane Maria inflicted in 2017. And now the U.S. territory is entering kind of a new phase with COVID-19, with some new tough stay-at-home orders actually just issued mid-August, with a spike of cases. InnovaCare Health, which operates Medicare Advantage and Medicaid plans in the territory, as well as in Florida, has been working closely with providers and government leaders to address the virus's spread. I'm happy to welcome the health plan CEO, Dr. Richard Shinto, today to talk about some of the challenges and opportunities in Puerto Rico. Richard, thanks so much for being with us. We know it's a busy time.
Well, listen, Matt, welcome. I'd like to thank you for the invitation. Really looking forward to the opportunity to give you everybody a little bit of an update of what's going on in the territories, because it's just constantly being plagued by disaster after disaster.
Right, sure. Well, so let's kind of start there. As I said at the outset, there's some new stay-at-home orders being instituted across the territory. Can you tell us sort of what the state of play is in Puerto Rico right now? I don't know that everybody on the mainland would really have a sense of what's going on.
I think the government did a very good job at during the first few months of the pandemic. They closed down the island. No ships were allowed to come in. Tourism was stopped. And the reason they did that was they don't have a deep enough healthcare system in order to have the ventilators and all the necessary means to protect all the residents of the island. So the governor just did a mandate across the board, curfews, shut everything down, lock-ins, and they did a very good job of really suppressing the infection. And our numbers are very low. Even today, our numbers are still, I think maybe we broke close to 400 deaths total. I think there's maybe 24,000 positive cases. Right now, I think on the last numbers I've seen, probably about 400 people are in the hospital. So they've done it, and really that's more of a surge. It was even lower than that. But when they started to open up everything, and especially bars, all of a sudden there was another surge. And I've met multiple times with the Secretary of Health, and he focuses around holidays. So he noticed all the surges were coming 4th of July, came Father's Day. They're anticipating one for Labor Day. And that's one of the reasons they're putting a lot of pressure, and they're implementing a lot more stay-at-home policy. Currently, the stay-at-home policy is there's a curfew at 10 at night till 5 in the morning, no alcohol after 7 p.m., and on Sundays everybody has to stay indoors unless it's just for grocery shopping or pharmacies. So again, the government is putting a lot of pressure on everybody. And the difference between Puerto Rico and a lot of other places in the country is they actually do implement it, and they actually do fine you. So the fines can be up to $500 if you're not wearing a mask. And you wander around the streets in Puerto Rico, and everybody has masks on.
Well, and you've worked closely with the governor down there and the government in Puerto Rico. Yes. Obviously, plans and providers in the mainland have been trying to work with their states as well. Can you talk about your experience of working with the government in Puerto Rico versus maybe what you're seeing in Florida, and what are the key differences there?
It's interesting. Most of my healthcare career has been in California, and then I started running companies across the country. And what happened when I came to Puerto Rico is when you go to DC or you're trying to get support, there's always confusion who you're representing. And one of the things that I think Puerto Rico's done a very good job of is creating alignment. There's alignment between the health plans, the providers, the hospitals, and the government. So when we go to DC or when we speak on behalf of the island, it's usually one voice. And as a result of that, it's brought a lot more clarity as to the direction and decision making that goes on. So if the government knows that they have an issue with the hospitals on, say, ventilators, they're going to go to the MCOs or to the managed care organizations and to the providers to try to find out different ways of suppressing the infection rate. And one of the best ways was for the government to implement curfews.
Interesting. So you referenced also working with providers. I know that you were doing some advanced payments to doctors and hospitals in the early stages of the pandemic. I believe those are still continuing, right?
Yes. To date, we've paid out somewhere over $160 million of advance payments to the providers, both the hospitals and to the physicians. And realize something, that many of our specialists are fee for service. So we did quick calculations on what our average pay to them was. And from that, we were able to advance pay them. You know, it's interesting about disasters and the number of them that hit the island. One thing you learn very quickly, and we learned this after the hurricane in Maria, when it really devastated the island, is the physicians needed the income. And they're not going to be able to submit encounter data. And some of their offices were in shambles, so they can't rebuild. And so even during that one, we advanced paid the doctors before the hurricane even hit. On this pandemic, we advanced paid the doctors before we even shut down the offices. So we knew that they had income coming so that they can continue to take care of the beneficiaries and the members.
And let's back up a little bit. We probably should have started here, but what is the state of clinicians in the island? A lot of people left after Hurricane Maria, and not as many came back. So is there capacity? Is there enough capacity there to treat the patients that may be getting COVID?
Hospitals, we have somewhere around 65 to 70. We have adequate number of hospitals. They might not be at the same level and quality as a lot of the hospitals in the state. So that's one area. The other area is providers. We have a lot of primary care physicians. What we're struggling a little bit was the attrition of certain specialists. And maybe many years ago, the training systems on the island are very good. But over the course of time, they've had some struggles. So a lot of the kids, they go to the States to get their postgraduate training, and then they decide to stay in the States. And that's why you're seeing the number of specialists on the island going down. But, you know, we're actively always recruiting and looking for specialists that want to come back to the island. And, you know, I know a lot of kids, they leave, but if they could find a way to come back, they do want to come back because, again, their family's here.
Sure. One of the other areas I wanted to talk to you about that, probably could work in the mainland too. You've been working a lot with pharmacies for at-home delivery of not just regular prescriptions, but over-the-counter pharmaceutical supplies as well. Is that right?
Yeah, it's interesting. When I got to the island, you immediately, as you practice in the States, you think about mail order and you think about chain pharmacies. So I went down that path, but that doesn't really work here. A mail order isn't very successful. So over the course of the years, we've really got into home delivery, and our plan has really focused on that. So we do home delivery for almost everything. You can do home delivery on your pharmacy, all your over-the-counter. And even prior to the pandemic, we were already starting home delivery of food. And I've got to tell you something. One of the things that Puerto Rico is great for, it's a great testing ground. And when people started to be able to get all their medications, all their PPE, if they wanted masks or they needed antiseptics for their hands, they just put it on, they go into the website and it gets delivered to them within 48 hours. Our delivery is very quick. And then we started delivering food. And then people didn't want pre-cooked, they wanted to make their own food. So then we went into groceries. So you can go onto our sites and you can get whatever you need. And it's a great online ordering, and even to the point now we've built it into our benefit design so that members can get an iPhone, because then the app is already loaded onto their iPhone, so they could order all their over-the-counter, or if it's connected into their pharmacy, they can get their home delivery on pharmacy too. But we believe the future of healthcare has to be in that space of delivery, because everybody talks about San Juan. And then you think, oh, okay, when you fly there, it looks like a regular city, but you just go 10 minutes out and you're into the mountains. And delivery out there is very difficult, and transportation is tough. So the company in the area of social determinants has really focused on home delivery and transportation to see your providers or pick up whatever you need.
So you've been doing that pre-pandemic, you're doing it during the pandemic. How do you see it growing potentially after the pandemic?
It's going to continue. I mean, I see our competitors, everybody wants to put it in place. We're seeing it in the States. I mean, when it's interesting. I was at home. I was in California for a period of time, and the number of packages that pile up on your front porch from Amazon or wherever you're ordering, and then pretty soon you got used to it. I mean, you could say, well, I don't really need to go shopping anymore. I just order all online and it all gets delivered to my house. And My risk for anything is pretty low. And a lot of the members like that now. If you look at the number of over-the-counter ordering they do, um, it's we're like almost 50,000 orders per month from our membership. So it's very high intensity, and membership really likes it because they don't have to leave their home. Plus, it's pretty much everything that they could get in the pharmacy or in the store is on our website.
And so as you look at that in the supply chain, what challenges have you had, if any, of building up a supply chain of goods and services that folks may be asking for?
I think there's two parts to that answer. I think one thing we learned after disasters is you got to be ahead of the supply chain. And I remember all the water we had ordered after the hurricane and the generators, but FEMA came in, they took control. And it bothered us that we had a great supply chain. We had pre-ordered a lot, but then the government comes and takes over. But one thing we knew is every time a disaster is coming, we're preparing. When this COVID thing came, we pre-planned and we went to the supply chain. Where were we going for PPE, COVID testing, and PPE, COVID testing, and technology, computers. And so we were able to move 3,500 employees out of the offices into their homes in less than a week. Wow. And we had a lot of supplies like computers, modems for people that needed it. We did a great job on pre-ordering on PPE and on COVID testing. But again, the government came in and they confiscated everything. So all of that, we had to struggle to get the masks, or then we had to go to China and get a mask when before we had all our masks and our COVID testing coming from the States. So it has created some problems. And even today, because the limited amount of reagent on the island, the government, now this time the Puerto Rican government, has taken control of testing.
So some of that PPE was taken from the island and brought back to the mainland from the federal government?
It wasn't allowed to ship to the island.
Oh, interesting.
It was redirected.
Yeah.
Even the COVID testing, we had pre-bought. As soon as that happened, I mean, being a physician and thinking about looking ahead and finding out what we needed to have, masks, gowns, and gloves were really important. So we went after those. And then the testing, and we were able to buy a lot of testing, but then they would get stopped at the ports, and then sometimes the government would take over in the States and then redirect it someplace else.
But do you feel like we've heard that about reagents, not that it's been redirected, but that there's been a shortage of supplies on reagents. Do you feel like you have enough now?
No, if you're asking about some of the rapid tests, we were able to get a lot of, but now that the FDA is in a toss-up as to how accurate they are, now we have to go to other types of testing, and we have. But again, the reagents are a little bit difficult to get a hold of. And the government, especially the Secretary of Health, is very focused on testing. So there's a lot of testing going on, and because of limitation on reagents, the local government has taken control of testing in order to, be able to identify who actually is going to need it, and it's just not everybody. It's kind of interesting now. You're hearing news wires talk about the criteria for getting tested. Before it was everybody should get tested. Now they're saying, well, not everybody now. You're not sure what's the real reason, but again, that's constantly in play.
Sure. I'm curious too, Rick, as we're in hurricane season. Puerto Rico is still sort of rebuilding from Maria. And I know you've been doing some telehealth, you've been working with providers on telehealth, but how prepared is the island for another natural disaster amidst a COVID pandemic?
I think we're very brittle. I think that the island has done a good job after the hurricane. FEMA to a degree helped, but the reality is the power grid is very weak. And what most of us are very concerned about is if a disaster hits, it's the power grid. If you think about the Hurricane Maria that came through the island, just devastated the island, it came in from the east. The power grids aren't there. The power grids are to the west. And that's why when the earthquakes earlier this year hit the island, there was a lot of issues with power then, because it was close to the power grids. But again, power is the key here. The other part, second, obviously water is very important. So power, water, and the third is the internet. Having the internet connections, you think about the island is just out here 1,000 miles from the mainland. When something devastating like that comes, you lose power, you lose water, and you lose your connection through the internet, and it's a very scary process.
And so what do you do? I mean, are there plans in place should something happen to be able to go out and reach your members?
Well, we've done a really good job of that. If you look at, we were back up on the grid very quickly. We were back to our members. And then I remember during the hurricane, we set up our own caravans. So we had, we worked with Bacardi Rum. Bacardi Rum put together all the food, put together all the water, and then we had all the supplies. And we just went every other day for weeks into the mountains to set up clinics and pass out food and water. I think our company did an excellent job. The earthquake was a little bit different because one, it was very isolated to one part of the island, and this pandemic, we've done a good job of allowing the members to stay at home and doing a lot of home delivery. So the thing is, though, if a natural disaster hits now, what we're all concerned about is, will we have the power and will we maintain our communication?
Sure.
And it gets very concerning when you get outside the big cities.
Right. Well, listen, Rick, we appreciate your time. There's much more we could talk about. We'd love to come back and check in with you about some of the other things you're doing, but we appreciate your insights and analysis about what's going on down there in Puerto Rico.
Well, listen, Matt, thank you very much. And I really appreciate the time being able to kind of tell everybody about what's going on the island, because there is a lot going on and it's just a great place to be.
Right. Well, thank you so much and stay safe.
You stay safe too. Thank you. Thanks a lot, you guys. Bye-bye.
Bye-bye. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.